companies do business. And one of the big things in the field of health tech is wearables. A lot of people are saying wearables are going to change the way we treat and manage chronic diseases, which, if we're talking about cost, chronic disease is one of the big drivers of healthcare costs. But wearables have some problems. For one thing, people who have chronic diseases aren't really the same people who are using wearable technology a lot of times. And wearables themselves, they don't really deliver clinical data. So, how can we make wearables more effective? I am pleased to introduce Michael Lauk of neuroloop. You have the stage, Michael. Thank you.
Thank you for that introduction. That was actually the first part of my talk, so I already can jump over the first two slides. Let's start on the chronic disease side, and Sarah said it. It's actually not known by most people talking about healthcare cost and cost of the healthcare system, which is one of the major reasons why we're doing that. So 86% of all healthcare cost spendings in the US, I have US numbers here, by the way, because Europe is still not unique with respect to healthcare cost statistics. So 86% of all healthcare spendings in the US are for people with one or more chronic medical conditions. 50% of all US citizens suffer from at least one chronic disease. And just let me say that prevention is important. I'm not a person telling you we don't have to prevent, but unfortunately, this is too late for the next 30 years. One of the reasons is that my generation, I'm born 69, and people older than I are, they still suffer from chronic disease, and we have to treat them the next 30 years. And the other point, the last point, multimorbidity and non-adherence make it worse. So that means that we have lots of people suffering from more than one chronic disease at the same time. And specifically, even if there's an effective treatment available, for example, a pharmaceutical treatment, most people don't adhere, so they don't use it as prescribed. New estimates think about 50% of all patients don't use the therapies as prescribed. So this is all a big issue, and we were very excited years ago. I founded a company in the US that was concentrating on a smartphone app in 2010 that measured human tremor. And what we learned pretty fast is people who are actually supposed to use it, they don't use it. So all the wearables are primarily used by healthy people, and $12 billion dollar venture capital later, we learned that most of these devices are actually not useful that much in the monitoring or helping managing chronic diseases, chronic conditions. One of the biggest points is that there's no clinical endpoint, meaning there's no direct value for those who treat them, doctors, payers, and providers. And also mostly there's non-validated feedback to the patient. I give you an example. What does it mean for the diabetic patient if he is walking 2,000 steps more a day? It doesn't mean anything. It does also not mean anything to his doctor. Of course, we would say, great that you walk, but it's not linked directly to the chronic condition. So the primary value of all that may be prevention, and that doesn't solve the problem, as I mentioned. The other movement on the other side is we have a very fast movement, specifically in the US, towards the convergence of treatment and monitoring. Why is that? We start, and I want you to focus on the last point in the table. Today, we reimburse for the process. You get paid as a doctor for diagnosing the patient. You get then paid as a medical device company for selling a device that the doctor is using with the patient, and then there's another company who's doing the monitoring. If you reimburse for outcome, and that will change, it already changed in the US, there's a couple of diseases where they already pay for outcome, you have to merge treatment and monitoring. So the wearable is really something that's going to be integrated into the whole treatment process. And I want to tell you something about neuroloop's technology, which is an implanted neurostimulator that's doing exactly that. So the primary aim here is to treat hypertension, high blood pressure, with a neurostimulator. And what you can see here is just a schematic. There's a device then implanted in the upper chest. There's a cuff electrode. I'm going to show you later how it looks like. That is around the vagus nerve, who's a big nerve responsible for pretty much controlling all the autonomous nervous system in the body, including blood pressure, heart rate, and other things. And there's the implant, a computer that also delivers telemetric data to the outside, a tablet, for example. So the neuroelectronic interface is important to understand in that context I'm talking about. It's a very thin electrode, only 11 micrometers, made of a special material that's, as shown in the picture on the left side, wrapped around the nerve. And it has about up to 30 different electrodes that are wrapped around the nerve, so we can address by the computer that's actually driving the stimulator different parts of the vagus nerve. Here's a cross-section. So if we want to reach with our technology the inside of the nerve or the outside of the nerve, a certain fiber within the nerve, we can select the fiber selectively. So that's actually how it works. You have sensors on your heart, on the aortic arch, and these sensors are transferring over the vagus nerve the signals, and then you have your brain who's actually then controlling the blood pressure. You can see it a bit, I mean, in the context of IT people who are here. It's a bit like the sensor, transmission, and a computer, and we manipulate the transmission pathway, not the sensor or the computer. And the interesting thing now, going back to what I just told you about the wearables and the future of wearables, or what I call invisibles, is the treatment here is only one part. The more interesting part with implants like the one we have is each electrode that I've shown you out of these 30 electrodes also deliver data if you use them not to stimulate the nerve, but if you use them to measure signals. So what we can do is we have a device within the body. There's no interaction with the patient on the outside, so we don't have to have a sensor that's attached to your wrist or attached to any other part of the body. There's no other obligation because the patient is getting the treatment anyway. And then we have on the other side highly accurate measurement from the inside of the body. So for the patient, the device is completely invisible. And typically we know from also working with patients that it's not seen as intrusive as having, for example, a camera in your home that is watching you. So the result is maybe the same thing. You get data from your personal data you record from the patient to a provider or a doctor or even a relative or the patient himself, because the feedback is one part of it. But people see it as a treatment, but the treatment at the same time can deliver a wealth of information. So this is going beyond the treatment with the implant. So what we have is a measurement with the same electrode. As I said, there's no additional burden. And we can deliver valued information even completely outside the disease that we are actually treating, which is arterial hypotension. Because, for example, of course, we can measure extremely accurately a heart rate, the complete heartbeat, actually the ECG, from the inside of the body, 24 hours a day. There's way less artifacts, and we can deliver all this information over a telemetric interface that's in the device anyway, because we needed to adjust the treatment. And of course, we can equip these devices with more sensors like accelerometers, like temperature sensors, even inflammation. And this goes also back to other implants. So I believe that for treating chronic disease, implanted sensors can be one of the solutions, because the word chronic itself means people are typically, unfortunately, suffering from these diseases lifelong. So if you choose to wear every morning a watch or something that's even more intrusive, like a sticker to your chest or something like that, or you have once an implanted device that is at the same time treating you, there's certainly a choice for what I call the invisible. And I think it's clearly the case that we will see more implants, also implants that are used today only to, for example, joint replacement, to wearing sensors at the inside, giving telemetric capabilities. So I also don't want to hide you the biggest challenge we have. It's not a computing power, it's the energy. So we still struggle with one major problem, which sounds kind of funny, but it's the same thing as with electric cars. We can't store enough energy in the implants to have a huge computing power. And it's again hard to have the patient charging it every day, of course, because then you have the non-adherence problem back. Because if the patient isn't charging it, then you have the same problem as with the pharmaceuticals or other therapies that patients not using. So conclusions that are important in a more broad context of the digital part of the healthcare, what I would call it the digitization of healthcare is, first of all, an outcome-based healthcare system requires a merge of treatment monitoring. I think I told you that because this is going back to the manufacturers. People sometimes tell me, well, but this is a problem of the doctor, or it's a problem of the hospital. It's not a problem of the manufacturer, but the thing here is the pressure comes from the payer. I know an example from sleep medicine in the US, for example. You don't get reimbursement for the device or your treatment if you don't prove that the patient's using it and treat it. The same thing is now starting from April of this year from the CMS Medicare payment for joint replacements. So they pay the hospitals for 90 days with one fixed sum. And CMS says to the hospital, I don't care what you're doing, I give you one sum for 90 days, including all things that happen to the patient, inflammatory reactions, things that happens after that. So that changes the whole way your clients, if you sell a medical device, will actually see your product, and this also changes the whole way how you stay competitive. So I also believe that therapy devices need to deliver data showing progress and improvement. Very clear, we can't separate those two. And the next point is also going back to the problem we learned from the digital healthcare space and the wearables, that people don't use it, who are primarily chronic disease patients, specifically the mostly comorbid patients who are coming from, let's say, a social environment that is the English word underprivileged. I don't like it, but it's how we typically call it. So measurement sensors need to reliably deliver the data without having an additional burden for the patient. We just know from experience it's not working if there's an additional burden. It's very hard to get patients engaged. But on top of that, of course, you can have all these engagement also with technologies like that. I'm not saying we shouldn't try to have nice apps also for the patient, giving feedback to him. It's part of the whole game, but it's not the only thing we can do. The next point is therapies need to be adjustable to patients' individual need and preferences. That's something we also can do with implantables. Neuroloop's device, for example, will be reprogrammed after the surgery to give the patient an optimal blood pressure range, and it even can be manipulated. This is now a future outlook, maybe in 10 years or so. It even can be we think about having the patient manipulating it in a different situation, because you may want to have a higher blood pressure in a certain situation, like if you have an athletic action around you, or you may have a lower blood pressure if you drive your car or something like that on the German Autobahn. So the business models, of course, not to forget here, we're talking about startups. The business models, they will change significantly. Today, most medical device companies on the traditional side, they say manufacturing price times 4 is what I sell the device for. And this is what the hospital or the insurance company is reimbursing me for. And that will change tremendously, because we will see very soon, and we always see them, the business models that are data-driven, for example, outcome data-driven. And then, of course, I showed you today that smart implants can help to solve the major challenge in the healthcare system by treating chronic conditions because of the word. Again, I want you to focus on the word chronic. That means those patients sometimes suffer from the chronic disease starting at age of 45, but they still have a life expectancy of about 40 other years. So we're talking about using a therapy for 40 years. An implant is certainly a good solution for most patients. Thank you. I think I'm on time. There's time for a couple of questions. The company neuroloop is a spin-off from Freiburg University and is actually financed by Escola B. Brown, which is another interesting example for this startup conference for a very close cooperation between a corporate and a startup. Thank you very much.
Questions? Do you want to take some questions?
Yes, of course.
Yeah? Who has a question? Be bold. I have a question. What sort of issues are you running into with data privacy when you're talking about implantable wearables? What are the regulations that you're coming up against?
My fear was that I get this question. No, there's two things. One is the ability to manipulate the stimulator. We have to be 100% safe on that side, of course, because if you manipulate a stimulator, you potentially could kill someone. This is basically reprogramming the stimulator itself. The other part is delivering data about the patient's health status to third parties. This is actually a discussion we need from a society standpoint. I'm very honest with that because there is no safe data. I mean, the audience here in an IT world, you know that. It's always a question of the price, right? We can make it safe, of course, but there will always be one hacker that finds a way around. So it's more discussion in the society. What kind of data do we want to share with the insurance company, for example? What is also the burden as a society we want to have on the chronic disease patient? And I can tell you there's two things. Some people tell me, the social system's actually breaking up if you force people to deliver data. But the social system's also breaking up if you have people, and I've seen them, getting a lung transplant for 110,000 euros, walking out of the hospital and start smoking again. So it's always two sides of the medal, and I think, again, the data safety side, data security, that's primarily, in my view, a discussion we have to have first on the society side. And then there must be an acceptance that there's a certain data that we are delivering first and almost to the patient also to put himself under pressure, showing, look, you're getting worse, or you're motivating, you're getting better, which is always the better thing. And I think to be honest, there is no completely safe data transmission. For the stimulator, yes, because that's another safety point, but not for the data that we measure that we then transfer with a smartphone to the doctor, for example.
It's a fascinating issue. I wish we had more time to go into it. Obviously, it's one that's of personal interest to me. Michael Lauk, thank you very much for being with us today and sharing the future of wearable technology. We appreciate it.
Thank you.
Thank you.